All right. See some folks still coming in, but we'll go ahead and get started. Hi, everybody. My name is Stefa Dragoon. I'm the Rural Population Health Program Manager at the Oregon Office of Rural Health. And I'm really excited to host the fourth of six in this population health webinar series. Today's webinar is Building Healthy Communities Through Strategic Partnerships, featuring Ruth Thomas Squance, Ashley Hernandez, and Alexis Sims of the Build Healthy Places Network. So this webinar series is really designed to establish a common understanding of population health and health equity, and strategies around really learning together and building out population health programs and having conversations about how to create change in our communities and within our organizations. So let's move forward. Thank you so much for being here, everybody. Just as a reminder, so we have two more sessions in the webinar series. In July, we'll be hearing from three of our population health grantees from last year's cycle to be talking about their programs and how they establish those programs, their intended outcomes, how did they identify needs, how they set that up. So I think that's going to be a really great session as well. And then August 9th will be more of a learning collaborative community conversation where we can ask questions and learn from one another about how to set up population health programs within your organizations. And another note is that the Oregon Office of Rural Health is currently accepting proposals to the Rural Population Health Grant Program. And I will put links to all of the things that I'm talking about in the chat. But the proposals are due July 7th. So just to put that on your radar as well. Great. So there are no conflicts to disclose today. And with that, I'd like to introduce our speakers. Ruth Thomas Squance is the co-executive director at the Build Healthy Places Network, a national center positioning cross-sector partnerships from community development, public health, and healthcare sectors to lead and leverage community-centered investments across the country to address the drivers of health and advance racial equity. Dr. Thomas Squance has a passion for health equity strategy, bringing an interdisciplinary lens and systems change mindset to the promotion of health and social equity. Ashley Hernandez is the research and product manager for Build Healthy Places Network, where she supports the field building team on developing high quality activities and content in line with the organization's national field building strategy. She has worked on a range of issues from economic empowerment to Indigenous philanthropy, with the goal of working with communities to build partnerships and create access to resources to build more equitable communities. Alexis Sims is the communication specialist at Build Healthy Places Network. She has extensive experience in public health project management and developing communication materials and content. She has worked in the nonprofit sector for over 3 years and currently assists the team with creating and developing resources to advance racial equity and uplift the importance of cross-sector partnerships. So thank you all so much for being here. Thank you so much to our speakers, and I will hand it over to you.
Thank you so much for that lovely introduction. As Steph mentioned, my name is Ruth Thomas Squance, and I'm the co-ED at Build Healthy Places Network. And we're a national nonprofit, about 10 years old, and we sit at this intersection between the community development, public health, and healthcare sectors. And our whole mission is really to try and transform the way the organizations can work together across sectors to more effectively reduce poverty, advance racial equity, and improve health in neighborhoods across the states. So next slide. I think that's actually the mission statement. The next slide. Our goal is to highlight really today the connections between place. If you could go back just one to what we're going to talk about today, the connections between place and health. And so we're excited to talk about the community development sector that works to enhance those places through housing, transportation, and all that kind of thing. Then we'll focus a little bit on the role of healthcare in addressing population health through multi-sector partnerships and introduce a rural playbook as a tool to support that kind of cross-sector partnership. And then we'll take a little bit more time to talk about exploring some strategies and case studies that can highlight them, that will be drawn from a rural playbook that we produced for addressing population health through multi-sector partnerships. And then finally, we'll share some information about our portfolio of tools and resources that are available that should we have inspired you to dig a bit more into this as part of your own work, you'll be able to do so. So if we can have the next slide. So before we begin, we'll set some context of the challenge we face as a country. And we currently spend a lot of money to the tune of an estimated $4 million per year on healthcare spending. And most of this is going on chronic disease. And much of that chronic disease are preventable conditions, as many of you know. And so in addition, these conditions that we know are overrepresented in less resourced neighborhoods where patients lack access to stable, affordable housing, access to healthcare, education, etc. And as you'll be aware, the challenge is really exacerbated in those managing care in rural communities with more aging populations and with less access to these resources. So next slide. At the same time, when we look at this chart of the contributions to premature death, for example, as a marker, we can see that research has already shown us that many factors are contributing to this health outcome. Behavioral patterns, social circumstances, your genetics and environmental exposures, and healthcare accounts for about 10% of those outcomes. But what we're doing is spending about 95% of our healthcare dollars going into that slice of impact. So this creates opportunities in the next slide. When we set ourselves that goal of achieving health equity, it really forces us to think about what do we mean by health? So when we expand that to go beyond just the absence of disease to think about well-being and thriving, then we need to address that we need to expand our focal length to include factors that are impacting health outside of clinical delivery system. So these interventions that address these are defined by their community-wide impact. Next slide. So at the network, we've been adopting a framework that we find very useful for describing how people get sick because of their social and physical environments. It's called the Vital Conditions of Well-Being, which many of you may have heard of. It's a very holistic framework and is a project of Rethink Health and the Wellbeing Trust. And what I like about it is that it emphasizes really that multifaceted nature of our systems that make up those social and physical environments that we know in combination have such an impact on community health. So I think in doing so, it also helps us think about when we set it out like this, what levers do we have that we can use for community change to improve and influence our environments and hence our overall well-being. And not to spend too much time going into it, but there are about 7 domains: lifelong learning, reliable transportation, thriving a natural world, humane housing is one of those. And so that would involve providing safe, stable places to live and establish vibrant, diverse communities and neighborhoods that are safe from hazards. And so within that, then you would have indicators such as increased home ownership, complete streets, or housing affordability, and more. Next slide. So in fact, the disruption of the vital conditions that we see in under-resourced, under-invested communities where those conditions are not met, people will then struggle, suffer, and begin to display the sort of health outcomes that we know exist in many of our communities of color, for example. And this drives more demand for more urgent services, more expensive measures that lead to even less resources that result in the adversity and vulnerability in the face of unexpected crises that come along, such as COVID-19. And then it sabotages efforts that we may be putting in elsewhere to maintain healthy choices. So one could ask, even if it's even reasonable to expect healthy choices to be made under those kind of conditions. Next slide. So I won't dwell too much on this slide, but just to clarify up front some of the jargon we use, we can think of delivery of clinical services as downstream interventions that work at the individual level, and taking a step back, and that moves upstream, is that growing movement that we see having the conversation at the doctor's office where we're screening people for social needs, those critical individual needs that generally fall outside of medical care, things like housing, economic security, food, and then connecting them to services. And really the bulk of what we're talking about today, and what BHPN focuses on is about moving this upstream to address those drivers of health in the community. So this would be community-wide impact approach, and this takes the form, it can be policy levers, systems changing, investments in housing, infrastructure, and systems of support. So is the answer then for health institutions to become experts in all these factors? Well, I hope not. And the key to upstream approaches is really cross-sector partnerships. Next slide. And one partner that is already engaged in working in many of the same communities is the community development sector. You have the next slide, I think, introduce it. Yeah. So the community development sector works to build wealth, economic development, housing and health sectors, and they're natural partners to tackle the range of issues in the built environment that impact the vital conditions for health we discussed earlier. So the things like affordable housing, homelessness, aging in place, improving health for under-resourced communities, all sort of critical issues that rural communities and those trying to serve and protect their health are facing. So next slide. One of the major sources for funding for the community development sector is this Community Reinvestment Act, or the CRA, which you might have heard of. And that's really developed from redlining, which was a government policy that was that rated neighborhoods for investment maps. And these were created, were incorporated into financial administration underwriting policy. And the racist concept that was underpinning this was that a minority population would drag down a place and that racial integration would cause a problem for land values. The lack of lending in neighborhoods created massive disinvestments with impacts on infrastructure that we still see today. So the CRA then emerged from anti-redlining legislation and is designed to encourage commercial banks and savings associations to meet the borrower's needs in all segments of communities that they take deposits from. So that includes low and moderate income neighborhoods. Next slide. So the term you'll hear a lot, and this is just a reminder for me, is that historical practices of redlining. And as a reminder, I take this is a number of headlines that I pulled from 2022, that many of those practices are dynamic, are still in existence, still causing impact. And so rather than a piece of history, it's a very active part of the structural and systemic racism and the impacts on the built environment. It impacts wealth building. And as we've already discussed, all those are linked to health outcomes. So next slide. So the community development sector then, it represents a mature sector. It comes with its own assets. this is just a bit of a busy slide, but just a flavor of some of the organizations that are involved. There are over 1,000 CDFIs that are certified by the Treasury CDFI Fund, and those are community development financial institutions. And we've named some of them here who are our partners. Opportunity Finance Network will be like a network of national CDFIs. There are also rural specific ones such as Rural LISC, Hope Enterprises, also active in the South, and certain CDFIs that are focused towards targeted groups. There are native serving CDFIs, for example. We also have CDCs, as we call it, the other CDC, which is the Community Development Corporations. There are over 4,500 of those nationally. Again, national associations of those, such as NeighborWorks America, and NACIDA, National Association of Community Economic Development Associations, and HAC, which specializes in rural housing, the Housing Assistance Council. And we have a partner finder on our website, so you can look up what organizations are active where you live and who might form part of your partnership landscape. So why multi-sector partnerships? Next slide, please. Well, we believe that multi-sector solutions are how we can more effectively mobilize upstream investments in the vital conditions that improve community health. And rural communities, we think, are especially well positioned to build these multi-sector partnerships. It really plays to the strengths of rural communities, leveraging that interconnectedness and the close-knit ties that can bolster collaboration across different industries that are an element that's critical to cross-sector solutions. It can support utilizing informal networks that can bridge formal sectors, sometimes a lot easier to do that in rural rather than some of the dense urban communities. It can leverage strengths from these natural linkages then to facilitate efforts that can address challenges that are often faced by rural communities competing to attract financial capital or harnessing community knowledge to drive solutions. And again, that sort of internal involvement is really good for sustainability, buy-in from community and populations. Next slide. So who is involved in these partnerships? And this is a graphic taken from our playbook, which we'll be coming to later. And when we began, we really discussed with our partners who is in the rural health partnership ecosystem. And you'll note that in the graphic, the factors are all centered around community. And this is an echo of what we see in that vital conditions framework, where it's constructed around centering, belonging, and civic muscle. And we believe this is an essential aspect of successful investments in community. It changes the outcome, it supports the sustainability of initiatives, and in terms of health equity, I think there's also an element that sense of belonging, social connection, and agency in the process of it is in of itself a positive influence in people's well-being. And I think it creates a foundation, an investment in that foundation that you can use going forward for more than one project. It's a more long-term sort of building platform. So we also think it's important to acknowledge how this ecosystem might look different in rural as opposed to more urban landscapes, and to sort of adapt that accordingly when we're making our plans. So we'll see sometimes some of the case studies later, how these various parties can come together to form the basis of actually funded projects. And Ashley's going to share that in some of the case studies. Next slide. So I've referenced it earlier, but the playbook itself, which was launched around a year ago, is a highlight various strategies that can be adopted by those working in the healthcare sector in partnership with community development, but also other sectors, which we'll mention, and other parties, to target investments that can have community-wide impact and address those community conditions in rural areas that can support health. The playbook itself is available for free from our website, which is buildhealthyplaces.org, where you can download it. And it really evolved from a journey of we created a roundtable of national leaders and organizations. We had rural advisory group to really sort of understand how our theory and our sort of premise of multi-sector upstream investment could look and emerge differently in rural areas. So I think with that, I'm going to hand it over to Ashley to discuss a little more about our case studies and dig into those strategies more specifically. Over to
Yeah,
you,
thank you,
Ashley.
Ruth. Yeah, thanks so much, Ruth. And as Ruth mentioned, we had many different conversations with practitioners when we developed the playbook, and four broad strategies emerged from these conversations. So successful partnerships across the field demonstrated these strategies: strengthening workforce and economic development, situating control locally, strengthening infrastructure, and increasing investments. And to be clear, many of the projects in the case studies featured in the playbook don't sit nicely in one of these buckets. In fact, many touch on multiple. But what we did find was these strategies are helpful in conceptualizing the work and the possibilities when embarking on these partnerships. Next slide, please. So first, we'd like to share a project featured in our playbook under the strategy, Strengthening Economic Opportunity and Workforce. So this is going to be a high-level overview of the case study because I'd like to use it to really illustrate how some of the themes Ruth mentioned earlier play out in the field. Next slide, please. So now I'm going to take you to Klamath Falls, Oregon. Perhaps some of you are already there. And this story is about a multi-sector partnership with Sky Lakes Medical Center, a not-for-profit acute teaching hospital located in the community. And in 2014, after a few years of doing work to address the social determinants of health, the hospital convened government agencies, community organizations, business leaders, and religious organizations to form a separate nonprofit called Klamath Works. And together with Klamath Works, Sky Lakes Medical Center is building the Klamath Works Service Campus, a convening space for nonprofits and interrelated social service agencies. The services that exist on the campus now include a detox and sobering station and a behavioral health service provided by Link Access Center, the Gospel Mission that provides shelters for those experiencing homelessness, and a job service program operated by Klamath Works, all located on a single campus. And the picture on the right-hand side of this slide illustrates why one location for all these services is important. Because prior to this campus, these social services were dispersed. In fact, it required community members to make a 20-mile round trip to get from one location to another to access things like housing assistance, unemployment services, etc. And this is in an area of little to no public transportation, which resulted in individuals falling through the cracks as they were trying to obtain these services. So here's how the partners imagined how this physical space would facilitate this process. A person would first receive a medical screening for health or psychological issues requiring immediate care from Sky Lakes. A sobering center will help intoxicated individuals stay out of the emergency room. Those who need a meal and a shelter would receive it from the Gospel Mission. Clients will then meet with job coaches to build an individualized plan aimed at bringing them to self-sufficiency, gaining the ability to care for their families and themselves, and eventually re-engaging again with the community. Next slide, please. So I love this case study because it really illustrates how a holistic approach to health really does require collaboration amongst sectors. Because in this example, partners wanted to not only address unemployment, but they had a common vision that to help residents find, keep, and succeed in a job, individuals needed to access services that met their basic needs and help them restore a sense of dignity and self-worth. So I'm going to briefly walk you through what each partner brought to the collaboration to make this vision possible. So Sky Lakes Medical Center purchased 18 acres of land that houses the social hub. The hospital also agreed to a land swap to relocate the gospel mission onto the campus. Finally, the hospital provided additional seed capital and used their social capital or reputation to help raise additional funds. The Klamath Falls Gospel Mission and the Klamath Basin Behavioral Health Center, which operates the Link Access Center, each provide important social services, such as the shelter for the unhoused, a community garden, and a dining space to foster those social connections, and of course, behavioral health and addiction treatment services. And I also really want to highlight another important partner, the Klamath Tribes, because this partnership really showcases the importance of trust and relationship building ahead of making an investment. And again, this is a really important theme in our playbook, and pinpoint this or put a pin on this idea because we will touch on the theme of trust again in this presentation. So because this partnership convened a multitude of community members, including those who may have been historically marginalized, like the Klamath Tribes, the partnership is able to provide support that will be utilized and will benefit everyone in the community, meaning there's less opportunity to leave some groups behind. So for example, the Klamath Tribes not only provide funding and staffing for the Link Access Center, but they've also integrated culturally responsive practices into their services. Next slide, please. So you might be wondering, wow, that's a really great story, but how do you actually build partnerships across sectors to address community health issues? Next slide, please. Well, the Build Healthy Places Network's playbook does include a tool called the 5-step path to multi-sector rural partnerships. And this resource offers suggested steps, key questions, and other sources to help guide you through the process of forming cross-sector collaboration. So right now, we are going to do an exercise by using one of the playbook's case studies to walk through the tool. And I do want to mention that this tool has many different subsets as well as additional resources, but I'm just going to go over a few to give you an idea of how you can actually use this tool in practice. Next slide, please. So the case study that we're going to use to walk through this tool features St. Alphonsus. That's a nonprofit health system with 5 hospitals in Idaho and Oregon, and is a member of Trinity Health, the nation's 2nd largest Catholic healthcare system. So St. Alphonsus partnered with Leap Charities, which is a nonprofit, and IndieDwell, a housing manufacturer, by becoming the first investor in the Leap Housing Trust. So it was the first community land trust in Idaho. And with the land trust model, owners own their home while the trust retains the land underneath the home, which allows the homeowners to gain some equity while properties remain affordable when sold to the next buyer. So St. Alphonsus made an initial $240,000 investment, which helped the trust attract additional investors and raise $2.1 million. And thanks to the growing amount of funds, the trust has built 14 affordable housing units in Boise and is actually now expanding to Mountain Home, Idaho, a rural community with a population of just over 14,000. And this slide actually features an image of one of the homes in Boise that sits on the land trust. And as you can see, it's a beautiful single family home. Next slide, please. So now we're going to go over the 5-step path to multi-sector partnerships. And step 1, it's important to understand which one of the vital conditions is most relevant and potentially impactful to your geography. So in the case of St. Alphonsus, even before they embarked on their partnership with Leap Housing and IndieDwell, they conducted a community health needs assessment. Using this data, they identified homelessness and housing as one of their community's biggest challenges. From there, they clearly pinned down their role in crafting an upstream solution. So St. Alphonsus, of course, is not an affordable housing developer, but they could invest in a affordable housing development. So by identifying the vital condition and their role, the hospital had a clear sense of what type of cross-sector partner they needed to pursue. So when St. Alphonsus reached out to different housing developers, Leap Housing stood out because of the land trust model. They helped St. Alphonsus see that their first investment into affordable housing could help build high-quality homes that remain affordable in perpetuity, and that their initial investment into the land trust could be leveraged to attract other investors. And so this common aim of creating perpetually affordable homes for the community created a shared vision that provided a common ground between these two different sectors. So let's say you've been working on a vital condition for years. Investigate potential collaborators who may be addressing the same vital condition and who are approaching this work with a similar set of aims and values as your own. So this is a good starting point because identifying the shared why can give you a common denominator to help you create a bridge across these sectors. Next slide, please. So make commitments. Your organization needs to make a commitment to an organizational strategy. So in the case of St. Alphonsus, before they made the investment in the land trust, the hospital system created a community health and well-being department, which established a formal structure with a budget and leadership fully dedicated to community health efforts. And so clearly not every organization is going to have the resources to create an entire department with a budget and staff to do this work. However, St. Alphonsus did use existing efforts and opportunities to build on this commitment through their community health needs assessment process. The hospital decided to test out a more grassroots approach, and they conducted 3,000 surveys and 40 focus groups as a touch point to outreach and start conversations with community members they don't normally hear from. And what we've seen from all the case studies we featured in the playbook is that the most sustainable collaborations were made up of partners who committed to an inclusive approach that builds trust across partners and gives power and voice to community members. So hopefully everyone remembers the Sky Lakes Medical Center example, their hospital approach that included a diverse set of partners like the Klamath tribes was really instrumental to designing services and projects that would benefit everyone in the community and help ensure that no one is left behind. So consider, what are your existing structures or opportunities to invite cross-sector partners to engage with your organization that can help open the conversation and foster that trust that's so important? So for example, it might be extending an invitation to serve on your organization's board. Next slide, please. So, of course, another important step is going to be assessing your organization's strengths, assets, and interests to pursue these collaborations. You can start by identifying which members within your organization already have connections with these potential partners and ask who is already involved in the community on a local or state level. So this can be, for example, nonprofit boards, fundraising committees, statewide initiatives that provide points of connection with folks from other institutions. And then, what assets does your organization have to bring to a partnership? And be creative about your asset mapping. It's not just about money. Money is important, but it's not just about money. So for example, we've seen both hospitals and community development organizations use data to make the case that investments in community health are important. Or you can use your institution's reputation and social capital to help bring in more funds and partners, like the example from Sky Lakes Medical Center. Next slide, please. Step 4, map and network. So mapping out your network and your relationship with your community includes accounting for your historical relationship and how your work is perceived by the community. So for example, St. Alphonsus and Leap Housing did not assume that their land trust model was one size fits all. When they expanded their developments into Mountain Home, a rural area, they considered both the current context and the negative perceptions held about affordable housing developments. So in the case of Mountain Home, the community was experiencing a spillover from people coming from Boise to a more affordable rural town. And this created pressure on the area's current housing stock. The residents also worried that these developments would come with rezoning and increased density that would erode rather than preserve the community's tradition of agricultural land, creating the fear that their rural community would eventually be transformed into an urban center. Next slide, please. So the mapping out of your network and understanding perceptions of your institution and your work will help inform you on how you approach step 5, building your partnership. So in the St. Alphonsus case, some of the perceptions of affordable housing were negative. So how do you build the trust needed to craft that shared vision and that value proposition among partners and community, like we saw in the Sky Lakes Medical Center example? Well, what St. Alphonsus did was they started by using data, storytelling, and forming broad partnerships in the community. So for example, they presented data that illustrates the current housing context, such as how many jobs at $20 an hour exist in the community and the number of hours you would need to work to purchase a local property. They combined this with storytelling to counter misconceptions around low-income tax credit-built units, humanizing residents, and sharing examples of what beautifully maintained affordable housing could look like. As the director of community health at St. Alphonsus said, we bring data for the heart, or we bring data for the head and stories for the heart. They also worked with local partners to help reframe the work so that it resonated with the values shared by the community. So rather than focusing on saying affordable housing, they talked about it as workforce housing and how housing that is attainable for everyone can support a growing workforce that strengthens the local economy and provides opportunity for all. So hopefully that gives you a flavor of how to use the 5-step path to multi-sector rural partnerships. And again, if you check out our playbook, we have many more different sub-steps that also includes additional resources. So you can get some of that detail if you look at our playbook on our website. And what I'm going to go ahead and do now is I'm actually going to pass it to my colleague Alexis, who's going to share with you a little bit more about additional resources that Build Healthy Places Network has developed.
Thank you, Ashley. Next slide, please. So I will go through a few of our resources as we wrap up our presentation. And as Ruth said earlier, all of these resources can be found on our website at buildhealthyplaces.org, and I have put the link in the chat. Next slide, please. Finding common language that we, back one more, please. I'm sorry. Okay, so finding common language that we use to communicate between sectors can be a challenge, but we do have jargon busters available on our website that can help you navigate the industry lingos. If you're lost in a sea of acronyms as you navigate the community development field in other sectors, the jargon busters can help you clarify common industry slang. Next slide, please. So our Measure Up page is a microsite of resources and tools that can help you measure and describe the impact of your programs on families and communities and on factors related to health. We have also gathered great examples, tools, and resources to help you make your case. We're also in the process of revamping our Measure Up page, and the relaunch is scheduled for the end of this year, so stay tuned for that. Next slide, please. So here are a few of our most recent crosswalks. The first crosswalk, the Power of Partnership, Solving a Challenge for Healthcare. This crosswalk features hospital systems across the nation partnering with community development in response to the growing need for affordable housing in the communities they serve. The second crosswalk, how infrastructure law creates new opportunities for community investments that address the social determinants of health. This crosswalk explores the intersection of infrastructure investment and the potential to seize this moment to impact health through partnership with community organizations, community development organizations, and health partners.
Our latest crosswalk is the third one. It's not just about the buildings, but it's about how community development organizations are promoting residents' mental health. So this crosswalk explores how community development groups across the country are stepping up to partner with residents to improve community well-being by proactively strengthening residents' emotional and mental health. And I've also shared a link in our chat so you can access our latest crosswalks. Next slide, please. This is our partner finder. This is a collection of directories to help you find the community organizations near you. As Ruth showed on one of her slides, there are over 100 CDCs that you can check out. We have the Rural Local Initiative Support Corporation, NeighborWorks America, or any other CDC that has a member directory that will point you to their member organizations in zip codes across the country. Next slide, please. So this slide shows you all three of our playbooks. So I know Ashley just provided you a brief overview of the rural playbook that features 4 broad strategies that healthcare sector can use to collaborate with multi-sector partnerships for rural health and prosperity. And you can look further in there to get a deeper dive on how those strategies can help you with the healthcare partnership models of investment. The second playbook is the Community Economic Development in Healthcare. This playbook offers a roadmap for community economic developers and social enterprises to partner with health institutions to create career paths for residents in low-income neighborhoods and BIPOC communities. Our last playbook is the Partnerships for Health Equity and Opportunity. This playbook guides community developers toward partnerships with hospitals and healthcare systems. And I've also added the link in the chat if you would like to check out those playbooks as well. Next slide, please. So lastly is our newest policy scan in collaboration with Wow, Wonderful, and Healthy West Virginia. So this organization specifically works in rural West Virginia communities to improve their overall health and well-being. And this scan provides a set of policy examples that prioritizes building a shared future and creating equitable rural communities where all people and communities are treated fairly, regardless of their race or socioeconomic background. And I have also included the link in the chat if you would like to access that. Please be sure to sign up for our newsletter if you would like to stay up to date with our latest resources and publications regarding cross-sector collaboration with public health, healthcare, and community development. Thank you so much for your time and the opportunity for BHPN to present. Now we will open the questions for Q&A.
So much for a great presentation. I'm Sarah Anderson. I'm the Director of Field Services. And since Steffa is working the slides and can't see the chat, I'm going to ask the questions of you. So to get started, in your Klamath Falls example, how long did it take for the partnership to develop from the very start to when all the services were provided in one place? And any tips for, kind of being patient along the way, because certainly there are roadblocks that come up with that kind of partnership development.
Yeah, what I can tell you is when I spoke to the former CEO of the hospital, he mentioned that they started the conversations in 2014. Granted, the hospital system, of course, had been working on social determinants of health issues for years. And from 2014 up until now, they're still relocating services onto the campus. So it is still not complete, and it is 2023. And I believe last year is when they added the behavioral health services to the campus. So that gives you a sense of the timeline, right? It's been close to a decade that they're working on this. And one nugget of advice that the CEO mentioned to me was he said what was so critical was really identifying that common vision and set of values that really held these different collaborators together because there are going to be roadblocks. There's going to be many different hiccups along the way that will be points of frustration. But if everybody has that North Star and is committed to that North Star, that can provide the fuel that you need to be able to maneuver, I guess, across some of those roadblocks over time. So really just being very clear with your partners around what is your shared vision and what is your shared set of values will really help support navigating some of the bumps in the roads. Anything else, Ruth, that you remember from that case
I
study?
think that's a great, Ashley. And the only thing I would add is that not every collaboration is going to end up with such a big outcome initially. And there is nothing wrong with getting to know your partners through smaller initiatives, smaller things that you can partner together to build that foundational relationship that can grow. And part of the key to that is moving away from thinking about partners you already have in a transactional manner to think about the long-term impact of building on each project. So rather than we're done, we say goodbye and we don't speak again, we're like, think about how you can build, continue that, and what else can you do? Where else can you add to that existing relationship?
Yeah, and I would just add one more thing to that. Ruth, you reminded me just to really re-emphasize that Sky Lakes Medical Center had been doing social determinants work well before this. And so, the folks that we spoke to really wanted to reiterate that, like, this wasn't their first go at it, but of course they had been building relationships in the community well before this really big project that they embarked on. So Ruth is right. Some of those like initial partnerships around things that may seem smaller are still really important to help build the trust that you're really going to lean in on as you embark on bigger projects.
Great, thank you. And kind of a follow-up to that too. So we're talking about a decade and we know people come and go from organizations. What's your advice on keeping a strong partnership going and sustaining when different players come and go in and out of the project?
I mean, that's a great question, and I think it's always a challenge. And I think that's where diversifying the commitment to the project is helpful. You do need strong character leadership, but it can't rely on one person. And so sort of institutionalizing it as part of your goal, I think it gets back to what Ashley described as that shared why, a shared ownership of it. There's one organization called Purpose-Built Communities that has a model of investment where they have the community quarterback, as they call it, to be holding the different sectors together, that continuation. That is one way that you can have a consistency, but a shared ownership, not resting on one individual in your department that's holding all of this. It's kind of a cultural shift to have that shared ownership of these kind of partnerships.
Absolutely. Thank you so much for that. Next question. So from a financial perspective, and I'm thinking about the hospitals and the clinics in this scenario, what kind of ROI are you seeing with cross-sector partners? So for example, savings in preventable emergency room visits, or perhaps growing a patient population for the healthcare facility that's part of the partnership?
Yeah, that's a really great question, and it's a really tough one to answer. So we actually published a paper last year on child investment in child health through this kind of community investment, and did a review and just found that there are very few research studies or papers or outcomes that really try and nail that down. And I think part of it can be hard to define a sort of diffuse ROI across different sort of ways that it can impact. It's a hard thing to sort of nail down, but we found there was definitely a scarcity, and there really should be more of a call for that kind of information to drive what we see are anecdotal success stories, of which we have plenty, but I think what we need is more of a systematic change to be able to sort of engage more people in that. I don't know, anything you'd add, Ashley, that
Yeah, I don't have much to add. I will say this is an example. Unfortunately, it is in a urban context around a community development corporation that created an impact investment fund that hospital systems have invested in order to create mixed use income housing next to transportation links. And the reason why I mentioned this example, and I will add a link after I do a Google search in the chat, is they have created a way in which they can make basically analyze the investment on what is the return on your investment in terms of like how is it making the communities healthier. Are hospitals seeing less of an impact in their emergency rooms? And they created a particular formula to help make that assessment even before they make a particular investment. So this is just like one framework that you can look at. It's experimental, it's very interesting. I don't know how much it can be replicated in other places, but it's a place to start.
That would be really great to see when you look at the literature around ROI on these sorts of things. It is really kind of difficult to find that research, so that would be really helpful. Okay, and last question that we have is where does the public education infrastructure fit in the rural health partnership ecosystem?
Yeah, it's a good question. There are many ways that fits in. The most basic being around co-localization of services in that sort of multi-sector sort of ecosystem. Another I can think of is in the community economic development playbook that we shared, that was healthcare partnerships with community economic development. There are so many opportunities for partnering with the education system as well as the infrastructure. One example we had, which was not rural, but it was Metro Health, partnering with community colleges, adult education opportunities in terms of wealth building and entry level positions within the healthcare system to increase economic opportunities. Another opportunity that we have seen is land swaps between institutions and use for affordable housing. Again, kind of feeding into that co-localization aspect that I spoke about. And there are community development financial institutions such as LIFT, the Low Income Investment Fund, that specifically invest in early education facilities. So again, with drawing that dotted line to the connection of what we know impacts health downstream eventually. Yeah, there's all that sort of network of connection. Anything you'd add, Ashley, while I was talking?
No, I think that covers it all.
I mean, this was healthcare focused. We don't specifically have any education examples in this playbook, but yeah, check out the community economic development.
Great, fantastic. Thank you so much. And we don't have any other questions in the chat, so I'm going to turn it over to Steffa.
Thank you. Does anyone else have any questions? You can go ahead and unmute and ask away if you do. Okay, well, thank you so much to our amazing speakers. Thank you so much for coming, everybody. This was truly a wealth of information, and I'm so thankful that you three were able to come and present. Thank you, thank you, thank you. And just a reminder to everybody, if you would like CE credits, I put a link in the chat to fill out that survey, and you will be emailed a certificate as well. Thank you. Thank you again. Have a great day, everybody.
Thanks for your attention, everybody.
Yeah, thank you, everybody.
Thank you.